To what group of drugs does Grandaxin belong?
Grandaxin belongs to the class of drugs known as anxiolytics. That is, they are tranquilizers derived from the benzodiazepines system.
And what are the effects of the drug? How effective it is as a treatment?
The drug has a very positive effect that can be primarily observed during the day. It removes anxiety and stress, that is, psychological stress. It takes away worry and fear. While taking away these negative emotional states, the drug simultaneously treats and prevents autonomic dysfunction.
Is Grandaxin available over the counter or only by prescription?
Yes, of course. It's psychoactive substance in anxiolytic family, so it's only available by prescription and only administered by a doctor's order.
For what conditions is Grandaxin prescribed?
Its indication for use are quite broad. Firstly, it includes neurotic disorders and neurosis. It can also be used in treating acidonephrotic syndrome. This is because its effect is not only calming, but also stimulating. The most important thing is that it doesn't induce sleep like other diazepines. It doesn't act as muscle relaxant. It doesn't cause lethargy, inhibit reflexes, or cause tiredness. This is an enormous advantage for people taking the drug for neurosis, and it does not diminish activity during the day. In this respect, it is a daytime drug which generally removes barriers such as anxiety, worry, self-doubt, uncertainty, dysautonomia, heart palpitations, lowered blood pressure, changes in pulse. Sometimes it could be sweating or dry mouth, nervous system changes related to internal and external organs, the respiratory system, and the cardiovascular system.
So Grandaxin helps in cases of vagus-vascular dystonia, tachycardia, conditions accompanied by a rise in blood pressure, rapid pulse, for example, panic attacks?
Yes, anxious states, worries, panic attacks. However, in panic attacks we use it as a prophylactic. That is, it alleviates these conditions such as phobias and anxiety. It's mainly used to treat anxiety. It's also important to know that it can also be useful in treating various forms of vagus-vascular dystonia.
Can the drug be used to deal with intrusive thoughts?
In this case, the drug isn't beneficial. It is a bit less effective in treating phobias and intrusive thoughts.
Can Grandaxin be used to treat withdrawal syndrome in alcoholics? And if so, can it also help with smoking cessation?
Well, in this case, we are already talking about drug rehab treatment. When treating addiction, we understand that withdrawal syndrome consists of somatic, neurological, and vegetative symptoms. It can specifically help to alleviate vegetative symptoms present during withdrawal. Grandaxin works very well to lessen the symptoms of withdrawal from alcohol. Regarding tobacco cessation, drugs like Mebicar and Adaptol are more commonly recommended. However, Grandaxin may still be applied.
It's just that Grandaxin has some possible side effects: vertigo, nausea, vomiting, allergic reaction, and headache.
If we are speaking frankly, this drug, which has been used for a long time in medicine, over 30 years, is known by practicing doctors to produce mild side effects, and even then only rarely. It's typically on the individual basis. Sometimes the drug can create an utterly paradoxical effect. However, in these cases, it is usually not a terrible complication. Occasionally, allergic reactions may manifest. The patient might have headache or trouble sleeping. Basically, these are complications that are easily treated by ceasing treatment or lowering the dose.
Does Grandaxin affect weight? Can taking it reduce appetite?
In modern medicine, side effects and additional effects are part of the process of applying the drug. This can be viewed as an additional effect. This drug performs two functions. It helps to alleviate stress, worry, and vegetative disorders, while simultaneously regulating appetite by removing stress eating.
You were saying that the drug affects the digestive tract. Why do patients taking Grandaxin sometimes experience stomach pains?
It happens very rarely when a patient has taken too much of the drug. It might occur where severe neurosis is present to the point of agitation of the digestive tract. These manifestations might not even be connected to Grandaxin.
Does taking Grandaxin have any influence on virility?
As opposed to other benzodiazepines, Grandaxin doesn't cause lethargy or somnolence. As a rule, a reduction in virility is not observed because it has low active dose. This drug isn't harmful to men.
Does the drug lower reflexes or concentration? Can people who spend a lot of time driving take the medication?
Grandaxin is considered a daytime tranquilizer. This means it can be used in the morning, the daytime, and of course in the evening. It doesn't interfere with driving, worsen or slow reflexes. It doesn't make the driver lethargic. Not only it is calming, but it regulates and removes anxiety. People are often afraid behind the wheel of what might happen, and the drug helps to fight this fear. That is, driving is permitted while taking the drug.
For how many days and what dose is Grandaxin taken?
As a rule, the drug should be taken 3 times a day. Considering a single tablet is 50 milligrams and keeping in mind body mass, the medical practitioner, and symptoms, we sometimes prescribe 1/2 to a full tablet 3 times a day. If needed, the maximum dose can be increased to 6 tablets a day. That is, if necessary, 300 milligrams a day.
How long is the course of treatment with Grandaxin?
Keep it in mind, it is a tranquilizer. There is an anxiolytic. It is in the benzodiazepine family. It is used for 2 to 3 weeks at a time. We try to achieve the needed effect during that time, so there aren't any complications, increased tolerance, or side effects.
How quickly does the drug take effect?
It has been noted that maximum concentration in blood is reached after 2 hours. In other words, you take the drug and experience the effect. In clinical practice, this effect regarding symptoms such as anxiety, stress, fear, and vegetative dystonia is observed on the 2nd, 3rd, or 4th day. So patients don't have to wait very long. The full effect of the drug is felt after 2 or 3 days.
How often can courses of Grandaxin be administered? How many times a year?
Well, usually we apply it twice a year. We take into account the recurrence of symptoms and recommend a course of treatment involving drugs from various groups. Or we may prescribe a sedative or other kind of tranquilizer to produce the needed effect. The primary objective is to heal the patient.
Can this drug cause tolerance or dependence?
This drug is unique in that physical dependence has not been observed, nor has withdrawal syndrome. Of course, the psychological sensation of comfort is attractive to many patients. That is, when taking the drug, they feel calmer and more self-assured. However, this is purely on psychological level. That's why it's crucial for us to move on other drugs, phytotherapy, and sedatives, to make sure this kind of dependence doesn't happen.